The information on nutrition and supplements out there for fertility and pregnancy is very confusing. The research has shown us that multivitamin preparations for improving fertility outcomes are probably only there with the male population and not necessarily with women. Unfortunately, because there are so many combinations and permutations of multivitamin supplements, we're unsure as to what combination and how much of each component in a multivitamin is important. Therefore, it makes it quite confusing. What we do know is that folic acid, vitamin D, and iron are all very important vitamins and minerals for pregnancy. There is emerging information that vitamin D may also be really important from a fertility perspective, as we know vitamin D is involved in the formation and initial function of the placenta. So it's important at least to determine if you are vitamin D replete prior to trying to conceive, because we know that somewhere between 20 and 50% of women in their reproductive years are actually vitamin D deficient. There is also emerging information that omega-3s are important for fertility as well. And omega-3s we tend to obtain in our diet through eating fatty fish or a combination of nuts and seeds. Whether or not we need to supplement in additional omega-3s is not clear in the research at this point in time. What is vitally important to have in place prior to conception is a supplemental source of folic acid. There is a lot of information now, some 20 to 30 years old, that demonstrates that those who are folic acid deficient have a much higher incidence of neural tube defects. And so it's a national recommendation that every woman who is trying to conceive have a supplement that contains at least 400 micrograms of folic acid in it.